Studies show that as people get older, they prefer to stay in their home. It's called aging in place. And some people are able to do that with modifications and resources. Amber Kuntz is with ThedaCare at home, and Amber helps people in our community find ways to stay in their home as they do get older. So you're going to walk us through some of the spaces in houses and talk about the things that you provide and ways to stay safe. So as we are starting here in the kitchen, what are some things that we should keep in mind when it comes to staying safe?
One of the main things we provide at ThedaCare at home are ambulatory aids, such as canes, crutches, walkers, rollators, wheelchairs. One of the big things we hear from patients is when they're using a walker, it's hard to grab things to go from one room to the other or to do any sort of cooking. We do provide walker trays, which are very, very helpful. You can take the item that you're looking for out of the cabinet or the fridge, place it on the walker tray, and move to that next area. One thing for the whole home that we should talk about as well is you want to make sure nothing's on the floor. Have that clear area, especially if you're using an ambulatory aid or just walking. You don't want rugs. You don't want clutter. You don't want anything on the ground that could trip you up. In the living room, one of the main pieces of equipment that we provide are electric lift chairs, which really helps a person move in and out of the sitting and standing position. With mobility issues, you absolutely can have troubles sitting and standing, and that electric lift chair will just move you right into that standing position, and then you can slowly go into that sitting position.
So when it comes to multi-level houses, what are some things that you can help with when it comes to getting people to and from places?
That's a great question. We have a lot of people that may have trouble going up and down the stairs. At ThedaCare at home, we do sell stair lifts. So it's a chair that you can go on a rail that goes right up those stairs and down those stairs. We can also do custom work inside or outside of the home.
Oh, okay. When it comes to just overall space and safety, what are some things that you talk about with people?
Absolutely. We like to do training and teaching, of course, with every patient that takes equipment from us. We fit them for it to make sure it's properly fit for them. We show them how to use it safely, whether it's brakes or wheels or different things with the equipment. We also always like to talk about make sure your smoke alarms are up to date, checked, and batteries are in there.
All good things for anybody to keep in mind.
Yes.
All right, Amber, let's go to the next space. So in the bedroom space, what are some things that can help people in here?
Yes, at ThedaCare at home, we provide a lot of things for the bedroom, such as a bed rail or a bed cane. A bed rail is your traditional bed rail like here. It can be used to help keep somebody in the bed. However, it's also used for mobility. We carry something called a bed cane, which is pretty innovative. It's more of a small handle, a small rail, if you will, versus the large rail, where you can use it simply for mobility to hold yourself steady to get in and out of the bed. We also carry wedge pillows. So if you need to elevate yourself, your head, your feet, the wedge pillows can assist with that. Another issue in the bedroom is dropping something out of bed and you don't have the mobility to pick it up easily. We sell reachers and grabbers.
Really just things to make it easier as we get older.
Absolutely.
All right, let's take a look at our next space.
Okay.
So in the bathroom space, there seems to be a lot of areas that could potentially create some hazards for a lot of people.
Yes, absolutely. The bathroom is probably the #1 non-safe zone for people with mobility issues. You can see here we do have a transfer bench. So some patients are not able to step into their tub as easily as they were before. You can now sit on the bench and slide into that shower area. We also provide shower chairs, bath chairs, things like that. If they're not able to get to the shower for any reason, we carry specialized wipes that they're able to use as a bath in a bag as well. For the toilet, a lot of times the toilet's just a little too low for someone to sit on and get off by themselves. We have risers available with or without handrails, so you can have that little extra mobility with the handrail as well. We have grab bars that you can put right into the wall or suction cup grab bars to really steady the individual any area in the room that they can.
Okay, these are all really, really great points, Amber. Thank you.
You bet.